Hello everyone, welcome to Talking Health with Dr Laz, your favorite health program on television. Yes, we're reaching you from Nigeria's capital city, Abuja. My name is Dr Laz Eze. This week is a very significant one in the health sector. From the 24th of April to 30th April 2021 is the World Immunization Week. Of course, COVID-19 vaccination is a topical issue, not only in Nigeria, but in Africa and around the world. And it's even more topical in countries where vaccine hesitancy is high. 25th April 2021, just a couple of days ago, was commemorated in Nigeria and around the world as World Malaria Day. Every year, 25th April is marked as World Malaria Day. And of course, anybody in Nigeria or in Africa, especially Sub-Saharan Africa, that doesn't know malaria possibly doesn't know about any other sickness or disease. Malaria is so topical, and as simple as people think it is actually one of the top killers of children under the age of 5 years, as well as pregnant women. So malaria will be our major topic for today. But before we go or deep dive into the topic, I want to bring some feedback from our previous program that we got from many of you from our social media handles and WhatsApp. Recall that on 6th of April, our topic was around the World Health Day, and we brought into focus the Association of Resident Doctors strike, or the NARD strike, which has been suspended. But the issues that were raised are still topical and yet to be completely resolved. So we got this message from a medical doctor working from the Abia State University Teaching Hospital in Aba, Abia State in Nigeria, and I'm going to read it out. It says, in ABSUD, that's Abia State University Teaching Hospital, doctors and other health workers are being owed 21 months arrears of salaries. 21 months arrears of salaries. How do you expect one to take care of their families and still carry on with expenses of the residency training? We have turned to beggars. Landlords no longer accept staff of the hospital as tenants. We now live from hand to mouth, unquote. This was from Dr. Azuma Emmanuel, who is a resident doctor at the hospital. 21 months of no salary payments. And I also heard that the members of the hospital management board or staff of the hospital management board that work in general hospitals in Abia State are also being owed for as much as 16 months and above. Having said that, there are so many other messages we got from social media boards. Going through them will mean we spend the rest of the program. But we ask you to keep sending them. We reply on WhatsApp. We can't take as many calls as we get, but we reply the WhatsApp messages as well as the ones we get on all our social media handles that are displayed on your screen. Let's take a break, and when we return, I'm going to be introducing my guests who are already seated with me, and they are very knowledgeable about issues of malaria. Do stay with us, we'll be right back. Welcome back to Talk Here with Dr. Laz, your favorite health program on television. This is the World Malaria Day 2021 edition. And with me in the studio, I have a fantastic guest. In Pidgin English, they will say it's Tier Rubber, a brand new national coordinator of the National Malaria Elimination Programme here in Nigeria, Dr. Perpetual Uhomoibhi. You're welcome to the program, ma.
Thank you, and I'm happy to be here. Hello,
yes.
Viewers.
Dr. Uhomoibhi is a director at the Federal Ministry of Health here in Nigeria. She's a medical doctor and also has specialist qualifications in public health. She's been working in malaria for several years, over 20 years or?
About 8 years.
Okay, about 8 years, but she has extensive experience in health administration here in Nigeria. Also joining the program with us is a Zero Malaria Youth Champion. He's also the lead for Block Malaria Project and also a medical laboratory scientist. He's joining us via Zoom from Jos. Welcome to the program, Mr. Odinaka Obeta.
Thank you so much, Dr. Laz.
Okay, thanks for joining us on the program. So, yes, it's World Malaria Day, commemorated a couple of days ago, especially April 25. But of course, every day should be World Malaria Day. And let's start from the basics. Let me begin with you, Dr. Uhomoibhi. In Nigeria, there's hardly any child or even adult that has possibly not heard of malaria. But it's not everyone that actually knows what it is, even though everybody will assume that they know what malaria is. So let's begin from there. What is malaria?
All right. Thank you, Dr. Laz. Like you said, malaria is a common household name in Nigeria in particular. Now, malaria is a parasitic infection and is caused by a parasite called falciparum, Plasmodium falciparum. That is a parasite that causes malaria. But also that Plasmodium falciparum is transmitted by the female Anopheles mosquito. So that is a cause of malaria. So for you to get malaria, you have to be bitten by a mosquito, particularly the female Anopheles mosquito, that would have bitten an infected person. And when the mosquito bites you and takes a blood meal, it will transmit, first of all, it gets infected when it has bitten somebody who has malaria, and then it gets infected and transmits it to another person when it bites that person. So that is the cause of malaria.
Oh, so is malaria the same as hotness of the body?
Well, malaria is not synonymous to hotness of the body, but hotness of the body, which we refer to as fever, is a symptom, and it's actually the main symptom of malaria infection. But malaria also has other associated symptoms like maybe sometimes headaches, body pain, general body pains, weakness, in younger children, vomiting, and so on and so forth. So when people have fever, they tend to equate it to malaria. But malaria can only be diagnosed when you do test.
Okay.
So when you have fever, doesn't automatically means that you have malaria.
Okay. So I think that point is very important. Hotness of the body and fever is not exactly the same as malaria. So you talked about tests. What kind of tests are done and which places can anyone go to do such tests?
All right, thank you. So malaria is diagnosed, like I said, when you take a blood sample from somebody. And there are two major types of tests, either through the rapid testing, which they use like a disc called the rapid diagnostic test kits. So they take a sample of blood from a prick in the finger, and they drop into that diskette. And then those who are trained to read it will read it. After a few minutes, about 15 to 20 minutes, it will tell you whether it is positive or negative for malaria. That is the quickest way of getting tested. Another is through the microscopic testing. So they take your blood sample, look at it make slide from it, and look at it under the microscope in the laboratory, and they will tell you whether it contains malaria parasite or not. So those are the main ways of diagnosing malaria.
Okay, thank you very much for that. Let me get to the medical laboratory scientist who is with us, Mr. Odinaka Obeta. Talking about malaria testing, I think I would say, if I'm correct, that malaria is one of the most misdiagnosed health conditions in Nigeria. Why do you think is so, coming from your background as a laboratory scientist?
Okay, thank you so much, Dr. Laz. First of all, I would like to let us know that about 97% of the Nigerian population, which is about 97% of 200 million people as estimated, are at risk actually of the disease, malaria. So when you see a situation like that, you would definitely come to realize that, we'll definitely have a lot of cases that, will be needing attention.
Would you want to
Can you hear me now?
Yes, I can hear you. Would you want to speak more around issues around diagnosis? Many persons, when they go for tests, they are told they have malaria. But sometimes what they have is just viral infection, which is self-limiting. There are issues around capacities of medical laboratory scientists on the use of microscope, either due to training or due to other reasons. Also issues on the point of care test, the rapid diagnostic test. So how do you think we can strengthen our diagnostic capacity in the area of malaria testing?
Okay, so I want to say that standard of malaria diagnosis is actually microscope of influx of rapid diagnostic test kits, which has helped in in the cases where you have a lot of people to diagnose in hundreds and thousands, especially in low resource areas. So, but we've come to realize,
okay,
according to several research, but then if such a sample, is allowed to pass through the gold standard of diagnosis, which is microscopy.
Okay, thank you very much, Mr. Obeta. Yes, the gold standard is microscopy, but due to inadequacy of personnel and also equipment at every service delivery point, the point of care testing RDT becomes important, and which is also highly sensitive and specific.
Yeah.
In diagnosing malaria.
Yes,
to a large
so
extent.
the rapid diagnostic test kits are actually very sensitive, and they've been tested, and once they are quality assured, the ones that are being used and deployed at health facilities, they are very sensitive. So when they do tell you that it's negative for malaria, it's most likely that the person doesn't have malaria. And like I said, microscopy is a gold standard, but then again, the microscopy result depends on who is reading it. So you need somebody who is trained properly to be able to read the slide correctly. So without you having the proper reading, there could be misinformation. So, but the rapid test kits are easily accessible, particularly for primary healthcare centers and rural and hard-to-reach communities in the country, so that people are able to have access to quick diagnosis and treatments.
Okay, so there's a certain issue around the malaria control, the advertising. There are complaints that advertising tend to make people skip the testing part. I know many years ago, I've worked on the malaria program for close to 3 years, and there were efforts by the National Malaria Program to stop pharmaceutical companies from just telling people, if your body is feeling hot and all that, take malaria pills. If symptoms are not going away, go and see your doctor. So, and at some point they are beginning to incorporate that testing part, but we still see some ads on malaria drugs that are skipping that aspect of testing. So what is the challenge that NMEP is having in that regard, in getting all pharma companies to comply or adhere to those
so
protocols?
the national guidelines for diagnosis and treatment of malaria stipulates testing before treatment. So we strongly discourage people from presumptive treatment when they have symptoms. And so you're right that what those pharmaceutical companies are advertising, it's not the proper thing. People should get tested before they get treatment with the recommended medications for malaria. And so we have been working with some of the private sector, particularly the manufacturers, to see that the correct message is going out there to the populace, that they need to get tested before they get treated.
I would like you to quickly talk about the specific treatment for malaria before we go to take our break.
All right, thank you so much. Now for malaria, there are two types of malaria when you diagnose. You have the uncomplicated malaria, which tests positive, that is not associated with the danger signs. So then you have the severe malaria, or the complicated ones where you see people having danger signs. Sometimes it's cerebral malaria when it affects the central nervous system, or you have those that affect the kidneys, and different, or that leads to associated with severe anemia, for instance. So that's the severe form of malaria. So when you have a positive test, you need to wait with the clinical presentation of the client or the patient, so that will determine the kind of treatment. So if it's at a primary health facility level, when it's on the uncomplicated malaria, then the recommended medication is artemisinin-based combination therapy, which we commonly call ACT. So monotherapy has been banned in Nigeria, And use of chloroquine also has been banned in Nigeria because they are not effective for the largely falciparum malaria which we have in Nigeria.
Okay.
So
could that be the reason why some people take some malaria drugs and they still don't get better?
Yes, because they are not taking it, either they're not taking it properly or they are taking the wrong one. Sometimes if you take monotherapy, that's just a single one, it will not work. But it has to be the combination, artemisinin-based combination therapy. For the severe malaria, of course, you have to quickly refer the person to the proper health facility where that can be managed, because there are also supportive treatment that person will require, such as blood transfusion, IV fluids and all that, to make sure that you can prevent death, imminent death in that person. Okay,
that's fine. So we are going to take a break, and when we return, we'll discuss more around how to achieve zero malaria, not just in Nigeria, but around the world. And I'm sure that you also want to know about the symptoms or how to identify when malaria has become severe, like Dr. Uhomoibhi talked about, and also other things that might present as malaria, but they are not really malaria. Do stay with us. We'll be right back. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. I've been talking about how we can achieve zero malaria in Nigeria, Africa, and around the world. And I have two experts with me, Dr. Perpetual Uhomoibhi, the National Coordinator of National Malaria Elimination Programme in Nigeria. She's also a director at the Federal Ministry of Health. And joining me via Zoom from Jos Plateau State, Nigeria, is a Zero Malaria Youth Champion and also a medical laboratory scientist. So I'll come back to you, Mr. Odinaka Obeta. I hope your network will be much better this time around. So I want to ask you about your thoughts on how we can achieve zero malaria. Nigeria accounts for about 25% of the global malaria burden. So it's to be impossible for the world to achieve zero malaria if Nigeria does not achieve zero malaria. So what are your thoughts around it as a youth champion, and what can young people do with a lot of energy? Over 70% of Nigerians are youth, in the efforts to stop malaria or beat malaria or block malaria or achieve zero malaria, whichever language you prefer.
Okay, thank you so much, Dr. Laz. The efforts that we have to make, cut across different sectors and different areas, like you mentioned. If you look at some of the things that we have, a lot of Nigerians, I've been on a media platform previously discussing this issue, and people were asking the question that people were saying that it's impossible for Nigeria to eliminate malaria because of how much we've generalized the symptoms and how much we see malaria as not a serious illness. You understand? It's becoming a big issue. But then, if we are going to achieve zero malaria, we must, first of all, believe that it is possible. I say this because of the thought that lies in the hearts of a lot of Nigerians. If we have seen countries like Egypt, Algeria, which are also countries here in the continent of Africa, eliminate this disease, it shows clearly to us that we can do so much. And we need to, first of all, start by strengthening our healthcare systems. We're talking earlier about the issue of diagnosis. It's not just we have issues. Yes, we have issues around diagnostics. We have issues around even fake malaria drugs in the market. We have a lot of issues around not having sufficient, personnel to handle both diagnostics and even treatment. You can see the issue of the brain drain, where we have a lot of doctors traveling out of the country because the pay is not convenient for them, and all that. So it's a big issue. We need to strengthen our healthcare system, ensure that we have quality diagnostics, in facility in place, and we make sure that there's availability of training and retraining of medical practitioners. Then we also need to make sure that we educate. The issue of advocacy needs to go down to the grassroots. People need to know that malaria is treatable and it is preventable.
So how can, I wanted to come to that. Specific things that young people watching this program need to do that is within their control, from their neighborhoods and from their homes.
Yes. So young people are innovative and they are creative. Can you hear me?
Yes, we can hear you. Please kindly round up on that thought.
Okay, so young people all over the country have one responsibility with regards to malaria elimination. Do your part, keep your environment clean, use insecticide-treated nets as much as possible, and do well to pass that same message to the next person before you. That is one step. Then young people also need to be given the opportunity at the decision-making table. We know that all over the world, no social change is ever effective without the engagement of young people. Why? Because of how much committed they are to the use of social media, and because this is the 21st century. So I want to say that if young people are given that opportunity, and there's a lot of investment in youth leadership, with regards to malaria elimination, we're going to make giant strides with achieving zero malaria, even in Nigeria.
Well, fantastic thoughts there. As you were talking,
Exactly.
The national coordinator was just nodding, and I'm sure that she agrees with most of the things you've said. But he started by saying whether it's possible. So let me put that question to you. Is it possible to achieve a zero malaria Nigeria?
Nigeria. Yes, I agree with him. Zero malaria is possible in Nigeria, but we need a collaborative and concerted effort by both governments, individuals, private sector, communities, partners that are working with us to come together for us to be able to achieve zero malaria. We need a strengthened health system, like he mentioned, for us to be, because you cannot eliminate malaria outside of a strong health system. So we need that, because most of the diagnosis and treatment is going to be done at health facilities. We need that. We also need funding, both domestic resources and international support from partners, for us to be able to roll out all the different strategies that the National Malaria Elimination Programme has developed. So he mentioned one of them. So we do have a new strategic plan now that wants to take us to some targets by 2025, and hopefully by 2030, yes, which is the WHO Global Technical Strategy to find at least 90% of countries are achieving zero malaria. We want Nigeria to be one of those countries that will say by 2030 we have also achieved zero malaria.
I can't wait to see
we want to be one of those countries, and so we have the tools, we have the strategy. But what we need, like I mentioned before, is a collaborative effort, everybody to come at the individual level. Like you mentioned, people have to take decisions to use the insecticide-treated nets, to sleep consistently every night to protect themselves from getting bitten by mosquitoes. Then you also have to take other preventive measures, such as environmental management, to make sure, because mosquitoes breed in a collection of body water, yes, around the houses. So you have to make sure that you don't have containers or old tires or where you collect water, particularly in the rainy season. That's why it's higher during the rainy season, because when the body water collects, mosquitoes breed and they populate and are biting people. Then other preventive measures like malaria in pregnancy.
Sorry, I would stop you because we are almost out of time. Yeah. Discussing these strategies and measures is like a whole program in itself. But there is one question that usually come up among people. He will say, okay, we know what carries this parasite, mosquitoes. Why can't we spray everywhere and get the mosquitoes out of the place? Why is that not being done if it's a good strategy? And if it's not, can you kindly tell our viewers?
So spraying everywhere, what we call larviciding, that is to stop the breeding of the mosquitoes. That is one of the complementary strategies that is within our strategy. But why is it not being done everywhere? Because first of all, WHO has specific guidelines for doing that intervention. So we are not at that stage yet, but we can also identify some communities that are at that stage where you can do larviciding and achieve that. But other interventions like the indoor residual spraying is also part of our strategy, and of course use of insecticide-treated nets also part of the strategies we have.
Okay, so we're also in World Immunization Week. In few seconds, do you see a role of vaccines in achieving zero malaria target. There
Yes.
are some media reports in the past couple of days around
New
tests
vaccine.
and new vaccines and all that.
Yes.
What are your thoughts?
Yeah, so yes, malaria vaccines are being rolled out, but mostly they are still at the research stages and piloting. If you recall, there's a vaccine that is being piloted in 3 countries in Africa,
Yes.
Kenya, Malawi, and Ghana. And the pilot was concluded last year, and we are expecting the result of that pilot, which will now inform the next phase of possibly scale up and roll out to other countries.
Okay.
So that's one of the vaccines that have reached that
So
stage.
as it is
Others
now-
are within development stages, like the new one that Pfizer has just developed.
Okay.
But it's not at that stage yet. You know, clinical trials, for you to roll out anything that involves
Yes.
clinical use, there are different stages that the vaccines
Must
have
go
to go through. Yes.
All right, I think we have to end it at this point. The message there, as it is now, there is no malaria vaccine approved for use in Nigeria. Is that correct?
Not yet in Nigeria,
Okay.
yes.
Okay, thank you very much, Dr. Perpetual Uhomoibhi, the National Coordinator of National Malaria Elimination Programme here in Nigeria. Thanks for being on the program.
Thank you very much. It's my pleasure.
So thank you, Odinaka Obeta, the Zero Malaria Youth Champion, project lead for Block Malaria Project, and so many other portfolios. Thanks for joining us on this program from your base in Jos, Nigeria.
Thank you so much, Dr. Laz. It's quite a pleasure to be here.
Thanks for joining us on the program today. Follow us on our social media handles, and let's see you again, same station, same time next week. My name is Dr. Laz Eze. Bye for now.